Hello. So now let's talk about clinical assessment. So this part concerns the part 2 of your worksheet on the case of Jan. So after you finish this lecture, if you finish this chapter, go check out the worksheet part 2. Clinical psychology is a branch of psych focused on the prevention, diagnosis, and treatment of abnormal behavior. So, the academic career for this, for you to become a clinical psychologist, is by you take your undergrad and then you take your psychometrician board. You have the option, and then you take your master's, and then you take your psychologist licensure exam if you want to, or if not, you can suspend it for later naman. So you can then take your PhD in psych or your PsyD if you happen to be in the US, or maybe in the future if it opens here. Specialize in clinical psychology, and then when you have the license necessary and the academic credentials necessary, you may begin to practice clinical psych. Okay? And at the heart of clinical psychology is clinical assessment. And what is that? It's a process of collecting information, lots and lots of information about an individual, so your case, to understand and arrive at an informed decision. So, what are we talking about when we say informed decision? So, when we say informed decision, it's an evaluation. So that's why the report of a psychologist is called a psych eval. Sorry. So tawag doon is a psych evaluation. So sa psych evaluation, usually that depends on what you're going to do. Is it may referral question. That referral question can be very different for each person. So let's say, for example, one referral question would be, let's say yung bata ipapa-adopt. Okay, so let's say may tatlong nag-a-apply na families to adopt the child. So you're going to do psych eval on each of the parents to decide, and then you're also going to do psych eval on the child. So the informed decision that you have to make is kung ano yung best fit, which family is the best fit for this child given the history of the child and the history of the family, given the capability of the family, the resources nila, personality ng family, and then also the personality of the child. So, may ganun. Or, pwedeng, for example, if a person is applying for work, so, diba? So, the question there would be, which one of the applicants is fit for the job? So, diba, if you're gonna do a psych assessment or a clinical assessment, or psych assessment in general, you would need to see ano yung characteristics ng person and compare that with what is needed for the specific job. Okay, and then make your recommendation. Okay, which one is the most highly recommended applicant to fulfill the job na kailangan. So, yun yung informed decision. So, sometimes naman, especially if it's in the clinical setting, the decision would have to be ano yung diagnosis na ibibigay sa patient, and of course, along with the diagnosis, ano yung treatment modality, ano yung treatment plan, how are we going to help the person recover from the condition. So, yun. So, that's informed decision. So, informed siya because you cannot just like see a patient and then see na, oh, that's the problem, na depressed daw yung patient, and then give a generic na treatment or a set of interventions. So, hindi pwedeng ganon. It has to be individualized. Okay? And to do that, you need to collect a lot of information from the individual. And that includes yung history of the person, that also includes yung personality function, yung personality niya, yung intellectual capabilities niya, yung specific na concerns na ina-ask sa'yo ng patient or ng person who referred the patient, along with a lot of other things. So we're gonna go over that pretty soon. So other aspects that we have to consider, of course, first is yung presenting problem and the dimensions of the problem. So yung presenting problem, we talked about that na in the first chapter. That's usually kung ano nagdadala sa'yo, ano nadadala sa'yo ng client. So, let's say the client says, hindi ako makapagtrabaho ng maayos. Right? So, that's the presenting problem. Hindi siya makapagtrabaho ng maayos. But then, you have the even bigger question, bakit? What's going on with this person? Okay? So, you then explore the dimensions of the problem to understand it better. Ano tong issue ng hindi makapag-concentrate sa trabaho, 'di ba? And then you look at the different areas of functioning of the person. And don't worry, we're gonna go in detail to that later on. And then you also explore the social context. What's going on around the person? Okay? And the idea is for you to eventually perform diagnostic formulation, to do diagnostic formulation. So, sige, let's check that out one by one. So, yes, here we are again, diba? So, first, we have to explore ano yung dimensions of the problem. So, let's say the person says, hindi ako makapag-concentrate sa work. Okay? So, you ask, when you say hindi makapag-concentrate sa work, what do you mean exactly? Like, what do you do? Ano yung work mo? Okay, so let's say the person says office work. Okay, so anong patterns of behavior? What's going on? Okay, so maybe the person says, oh, I arrive to the office and then ganito, I sit in front of my computer, or I talk to people, and then so on and so forth. So, i-explore mo yun. How is the person behaving? What's going on with this person? Kumusta yung appearance niya? So on and so forth. Are there other behaviors na nangyayari na hindi directly related to the work, pero that may also be relevant to the issue? So, for example, later on, you realize pala based on your clinical assessment, hindi rin siya nakakakain ng maayos, or then pag gabi pala, hindi makatulog ng maayos. Okay, so may patterns of behavior na lumalabas. Ano ang ginagawa niya pag hindi siya makapag-concentrate sa work? So, you have to ask that. So, you look at, along with that, you look at the excess and the deficits in the person. So, kulang sa tulog, diba? Kulang sa kain. Okay? O ano-ano pa. Or maybe, for example, excess. So, pwedeng, for example, may tendency siya to like overthink, diba? So, may ganun. And then, appropriateness of behavior. So, you see whether yung are there indicators na merong ginagawa yung person that is not appropriate to the situation he or she is in. So, let's say, for example, you hear na, the person pala is biglang nagdadabog siya, or bigla na lang siyang may sinisigawan na person sa office. Okay? Or whatever that is. So, at this point, hindi pa yun clear what's going on. Still, you have the question of what's going on. And still, you continue to gather information about that person. So, ano yung strengths niya or yung weaknesses niya? So, this is where, if you think about it, this is where you give a lot of the psychological tests. Diba? You look at the personality. Anong traits ang malakas sa ang expression sa person na to? And then in terms of abilities niya, ano yung abilities niya? Saan siya magaling? Saan siya weak? Okay, so that's dimensions to work. Because you need to see this in order to know ano yung nagko-contribute sa problem niya. So, diba, if you remember sa diathesis stress model, we look at ano yung reinforcing na cause, and then ano yung mga protective at saka risk factors niya. So you need to explore that here. Next is we look at areas of functioning. Okay? So when you say areas of functioning, and when you say functioning or functional, diba, we look at how well does the person deal with or adapt to yung situation niya, to the environment niya. So for example, in terms of intellectual functioning niya, is the person capable of living on a day-to-day basis independently, deciding for him or herself? Diba? Or is there always somebody that has to do the decision making, the planning for him or her? Okay? Emotional. So, how does the person deal with mga stresses in life? Can the person control or regulate his or her emotions pag may negative na events na nangyayari? How does the person deal with those things? Next is social, diba? Social or interpersonal. How does a person have like long intimate relationships? So I'm not necessarily talking about romantic relationships here, but does the person have relationships with friends na tumatagal? Kumustang relationship ng person with the family niya? Kaya niya bang, marunong ba siyang mag-interact with these people? So yun, so kumusta yung functioning niya dyan. And then occupational, so sa trabaho, historically sa work niya before, diba, paano, ano yung history niya, and ano yung other dimensions. Remember, if you look at yung issue niya is yung work, inability to focus at work. But generally, before this happened, kumusta naman yung functioning niya at work? And then, of course, coping behavior. Anong ginagawa ng person to cope? So, generally, this is also a major factor that you have to look into. Yung coping niya ba, adaptive or maladaptive? So, for example, if yung coping niya is inom ng alak tuwing merong stress in life, or every day, pag pagod sa trabaho, inom ng alak, is that adaptive or not? So, those are your various areas of functioning. Last, you look at the social context of the person. Ano yung family background ng tao? Is he or she living with parents, living with siblings? Are they close, or do they seem like they're distant? Is there, for example, when you ask the person about the family, does the person seem like medyo alangan siya mag-talk about the family or specific members of the family? How does he or she think about these other members? Is there a particular member na close siya? Is he more parang mas close sa mother niya or sa father? And then another one, intimate relationships. Does the person have a romantic partner? Okay, because then you can cross-check all the other things here. Kumusta yung relationship niya with the romantic partner niya? Diba? Paanong dynamics nila? And then, of course, another one would be friendships. Sino yung mga close na person sa kanya? Does he have a support system? So, occupation, no, kumusta yung trabaho niya? Ano yung trabaho niya? Is he like, especially if you look into like, issues like nawala ng trabaho, or na-demote sa trabaho, or na-assign sa bagong office. So, that might be something that would be very important to see, look at patterns of the behavior niya, especially sa dimension of the problem. And then, yung cultural background niya. So, that includes, of course, yung ethnicity niya, yung religious background niya, and then whether yung family niya is medyo traditional, diba, collectivist or individualistic ba yung culture, because these will have implications later on to help explain why this problem is showing up sa person. Okay? So, yan yung things that we have to... So, if you think about it, that's quite a lot. Diba? That's quite a lot. And there are various tools and techniques we can use to gather the necessary data to help us arrive at our informed decision. So, what is the goal? So, the goal is to have a diagnostic formulation or case formulation. So, what does that mean? Based on all the data that we get, so this is the one of the parts na, this is the mahirap na part sa psych. Okay? Because for gathering the data, if you have the interviewing skill and then if you know how to use the tests, the tools, then, and if you have the tools, then you have the data. But here, this is the part where you have to integrate the data. So you have to combine the data and see where each piece of information fits. So you can make a hypothesis. And that hypothesis is based on a theoretical perspective. So this is where your TOP comes in handy. Diba? So for example, if a person is experiencing problems at work, and then you realize that, you find out pala na yung work na yan is new na work ng person because the person just got fired from yung dream job niya where he's been working in for quite some time. Okay? And this work, his new work, is something that he never thought he'd end up in because he kind of doesn't respect it as much as the previous work. So, parang yung work niya before, he found meaning in it. Pero dito, wala. It's just repetitive. It's routine work that he does not like at all. So, may ganun. So, if you look at it from a theoretical perspective, if you see like, existential ba? Is it does the person think like the work he has is meaningless? Diba? So, may ganun. And then, you look at all the other information. So, kumusta support system niya? Ano ba yung, how do his friends and his family see that? Okay? And then, ano yung mga traits na maybe reinforcing yung negative niya na view sa current na work niya? Okay? So, if you put that information together, you can then create your hypothesis. And once you have your hypothesis, diba, you kind of have this person might be experiencing something. And if it fits the criteria for a specific mental disorder. So remember, just because pumunta sa'yo does not mean automatic kailangan paglabas ng clinic, meron siyang psychological disorder. That's not always the case. That does not have to be the case. Okay? But if, for example, nag-fit siya sa classification system, then we make a diagnosis. And take note also, sometimes may instances you don't need to name a diagnosis. Okay? Excuse me. So you don't need to name a diagnosis, especially because of the stigma attached to it. Sometimes you just need to describe sorry. You just need to describe yung symptoms. And yung importante dyan is ito. My God, I hope this is not COVID. But anyway, so importante dyan is ito, yung treatment plan. What are we gonna do to help the person recover based on the problem that we actually found? So, for example, remember yung presenting problem ng tao is hindi makapag-concentrate sa work. Pero it's possible when you're making the hypothesis, you see that the problem is not really just hindi siya makapag-concentrate. It's because the person feels meaningless, worthless. diba? Because, well, he lost a job. So he had to settle for something that's less sa paningin niya. And maybe the environment niya at home or with his friends not supportive of him. Maybe he has thinking patterns that are not also helpful. So maybe you come up with a diagnosis or maybe not. But still, the problem is there. Okay? His thoughts of his meaninglessness and purposelessness. So you still need to create your treatment plan. Okay? So you create your treatment plan, you try to address all the things that you think need to be addressed dito sa pag-formulate mo ng case. Okay? So ano yung problema niya? Are there self-esteem issues? Are there assertiveness skill issues? Do you need to help him challenge yung mga irrational thoughts niya? So all those things. So you lay that down here. And one of the most important things also is that when you're doing this, okay, it doesn't have to be something that totally ikaw lang mag-isa. So that's what case conferences are for. So of course, if you have a supervisor, you do need to consult your supervisor. And especially when you're formulating your treatment plan, you have to collaborate with your client. Okay, so you lay down what you found with your client and you discuss it with your client, and you allow your client to help in formulating a treatment plan. Okay? So yeah, so that's part 1 for clinical assessment.